With gum disease, the treatment-wise, I mean, the oral hygiene is really paramount. You really just, very, very diligent brushing and flossing. A water pick can be helpful. A water pick is a great tool. You can get them at all the bigger drugstores. It's a machine that has a reservoir in it. It's like a garden hose almost. And there's a little jet that you can direct at the gum line, and it'll send a pulse of water, or water with a little bit of Listerine, and that'll kind of cleanse any pockets or spaces between the teeth and the gums. And it's a very, very good tool, especially if you have limited manual dexterity. It's a very good way to help keep things nice and clean. Regular cleanings with your dentist or dental hygienist. Sometimes you may find you need local anesthetic or freezing if there's any pocketing to get the job done well. Sometimes they'll have to go down a little deeper, and that may mean some freezing. Another important thing with gum disease is to if there is active periodontal disease, or if there's active change in the teeth, then closing any spaces, if it's reasonable to do so. Now, sometimes we'll see spaces, but we may even wait a little while to see if there are any implications over time. If things are stable, then it may make sense to leave things for some time just to see what the changes are. But there are times when closing spaces that are large that may make sense in the short term. Treating with a periodontist, if we see advanced gum disease, then sometimes we'll recruit the help of our gum dentist friends, the periodontists. One of the things that I think with acromegaly, another direct effect, which may, I think, be frustrating for people who have acromegaly, and that's the way the bite changes. Because there can be a double whammy. You can get jaw pain or muscular pain. How many people have jaw pain in the group with acromegaly? Jaw pain. So that's a very interesting one. With the way the jaws work, the lower jaw is a very interesting bone, and it's interesting in the way it moves. The lower jaw has really two kinds of movement. It has rotational movement where it hinges open and close like a barn door. Also, the lower jaw can slide forwards and backwards or side to side. The home base position for the lower jaw is where it has that barn door movement, where it kind of hinges open and closed. And what can happen or in that position rather, what we like to see is all the teeth touch at about the same time. Now, if you get some teeth touching before others, or if the bites if teeth have moved a little bit, as you close, your jaw may be directed to move one way or the other. So especially if a person is clenching or grinding and their teeth are moving around through the bone slowly over time, the jaw will be directed to be off to one side or the other or forward. And what happens with that is the muscles that control the bite get stretched. And with that stretching of the muscles, people can develop quite profound pain with that. So most of the people with that condition, with pain, the jaw pain with acromegaly, it's most likely a muscular thing. It's most likely a pain in the muscles because the jaw is being directed one way or another. Now with acromegaly also, there can be bony changes in the jaw itself. That's just a confounding factor, and that could maybe magnify the problem. But certainly with acromegaly, as teeth move, TMJ or muscular pain is a very, very common thing. And that should really be discussed with your dentist, because there really are things that can be done to help that. Bite plane wear, and I'll get into that a little bit, really can help even the forces and keep things from being overloaded from both the muscular and joint point of view. The other thing with the bite change, the functional overload of teeth. With the functional overload of teeth, and that happens as the teeth move throughout the arch. We talked about everything hitting at once. Well, if you get teeth that are moving in position, the way they interact with the opposing teeth changes over time. And as that occurs, teeth can break down. I mean, teeth can snap. The fillings or restorations can break. Teeth can get loose. The nerves inside teeth can die off. So there's a bunch of things can happen in that way. Symptoms of TMJ, we say, I mean, it's funny, we always hear people say they have TMJ, and it's kind of like saying you have knee. You know, it's your TMJ is your temporomandibular joint, and I guess it's just the word on the street. But symptoms of TMJ would be jaw pain or facial pain, headache, but there are a lot of things that cause headache. I mean, posture, people get migraines, sinus things, visual issues, dietary things, all sorts of things cause headaches. So it's hard to really pin headaches on jaw concerns, but certainly TMJ issues can be contributory toward headaches, especially headaches you get in the side of your head. That type of headache seems to be the kind. Limited opening. Sometimes we'll get a person who will come in with a limited opening, and that has to do with muscles spasming. We'll see people sometimes who come in and say, you know, woke up this morning and I couldn't open my jaw. And you feel their muscles and they're very, very tender. And clicking or grating joint. We get people sometimes who have clicking joints. Most clicks aren't a really big concern. A grating joint is suggestive of bone on bone. That's a much bigger concern. But most clicks are not too big of a deal, but grating is more of a concern. Certainly if you have any of those concerns, you should speak to your dentist for sure about those things. One of the things I think that's really important with acromegaly in general is to get, when you see your dentist, get a really, really thorough exam to just establish a baseline so that you can compare over time. You can see if there are any changes, so then you can kind of get an idea of where it's going. With TMJ treatment, one of the things that we'll often do is we'll make a thing called a bite plane. And what a bite plane, this is a bite plane here in the picture. What a bite plane is, it's a plastic splint. When I first give them to people, they say, geez, Mike, that feels like a hockey puck. And they take some getting used to, but some people get more attached to their bite planes than they are to their spouse. So they really do work, no question. And the way a bite plane works is that it provides a very stable contact surface between the teeth. So when we talked about teeth closing and how when you close, your jaw can be deflected one way or the other, the goal of the bite plane is to allow an evenly contacting surface so that when you close against the bite plane, you don't get that deflection. You don't get the jaw moving around. With bite planes, and I believe in the dental community, I shouldn't say they're not adequately adjusted, but with bite planes, they often require tweaking. I mean, you have to go back and adjust them again just to get them to get them really bang on. One question I would have with a bite plane and acromegaly would be with the movement of teeth. I mean, there may be need to perhaps remake a bite plane. With acromegaly, where clenching or grinding or where TMJ issues are a concern, probably would make an upper bite plane as opposed to a lower one, just because the upper teeth move less than the lower ones in acromegaly. When there's jaw pain and acromegaly, sometimes we may consider adjustment to the bite. If we find that, for that x-ray that I showed you earlier, what I may do with that case would be to make some models on an artificial jaw and see if I could get teeth to fit better by adjusting the shapes of those back teeth to see if I could bring other teeth into appropriate bite. And then if I found in the models I could do that, then I may talk to the patient about maybe making those changes in the mouth. But that would just be one of the options. Sometimes we'll recruit the help of a physiotherapist or massage therapist to help us kind of massage those muscles to get them feeling better. Sometimes pain medication, and at last resort, TMJ surgery. In 19 years of practice, I've only ever had one patient that went on to proceed with TMJ surgery. It's really a very last resort. And typically with that, it would only be when there's kind of a progressive destruction of the jaw joint, which I don't think would happen with acromegaly. But there are cases where it could happen, I guess.